Our Capstone group project was about AI in healthcare. What to expect during this presentation is AI's purpose in healthcare, the disparities in ethics, epidemiological data enhancements, and financial impacts of AI in healthcare.
Between 2023 and 2024, AI use in healthcare increased over 36%. This rapid expansion shows how quickly technology is changing and how care is delivered. Healthcare organizations are being challenged to manage both the financials and ethical impacts. Providers are used to the constant changes, but this speed can be overwhelming. As exciting as it is, AI use can also lead to challenges, and it challenges the question, are we advancing too quickly? While AI has great potential, it also has some financial challenges for organizations. The biggest concern is job security. As AI streamlines tasks, it's leading to the staff downsizing, or what people think is downsizing. Another concern would be the upfront cost of AI, which would be major. There's also the concern of the rural or underfunded areas having limited access to not only purchasing AI equipment, but the upkeep as well. And finally, when AI misdiagnoses or mistreats or denies a patient, it creates an error and the organization then bears the liability. Even though AI has financial challenges, it also opens the door to big opportunities for growth and efficiency. For example, AI can streamline the processes by analyzing and organizing large amounts of patient data in seconds. Facilities then have a lot of overhead costs that are reduced, such as AI systems that can be used to schedule patients automatically. One of the most promising benefits is early disease detection, as AI can spot any abnormality faster than the human eye. Finally, telehealth helps bridge the gaps to patients that can't get the care they need, such as rural or underfunded areas.
Epidemiological data using AI. Rapid advancements in AI promise to enhance epidemiological surveillance, forecasting, and intervention prioritization. Those benefits depend on overcoming serious challenges in data, governance, ethics, and equity. Implementing a structured, stage-wide plan bridges the gap between AI promises and peril, turning data challenges into opportunities for ethical and equitable public health innovation. Accessing quality and reliable epidemiological data with AI allows us to improve disease control. The process of disease control will become reliable, reliable epidemiological data with AI, enabling easier and quicker discovery, helping hospitals and labs to discover predictable outbreaks. On the other hand, not all data is of good quality. Missing or outdated information is detrimental to AI systems, and for marginalized communities, they could be left out entirely. Another thing is Another thing is that not all hospitals use the same systems, making it hard to send or share any type of information. Consumer trust. Trust in AI begins with data transparency and quality. In epidemiology, public confidence depends on how AI systems collect, use, and protect health data. Clear communication about AI's purpose, data source, and limitations encourages acceptance. Clinician oversight and explainable models ensure human expertise remains central. Regular bias audits and public reporting of performance promote accountability and reliability. Some of the challenges we may face is data privacy. Recent data breaches have left millions of Americans' privacy at risk. Communication. The use of AI in healthcare shouldn't be a secret. And accountability. Patients have valid concerns when it comes to accountability. Epidemiological data using AI and the challenges we may face. We have data quality, algorithmic bias, cost and operation risk, and governance, privacy, and trust. However, some of the opportunities we could get from using AI are enhanced forecasting. AI based surveillance shows promise in detecting, monitoring, and predicting disease by analyzing large data sets to identify patterns, predict outbreaks, and support public health decisions. We have cost effectiveness. AI augmented screening or surveillance tools have the potential to lower cost and improve outcomes. And we have equity aware AI design, embedding fairness constraints and community input into model development can produce tools that help reduce disparities rather than worsen them. Health disparities and equity. Artificial intelligence has rapidly transformed industries, offering new tools to solve complex problems. However, the development of AI also raises significant concerns about exacerbating existing disparities. At the same time, when thoughtfully designed and implemented, AI has the potential to promote health equity, ensuring underserved populations receive improved access to resources and care. Some of the challenges we may face would be bias in AI systems, limited access to technology, and exclusion of people with disabilities. Health disparities and equity. Here are some of the opportunities we could get from using AI. Incorporating inclusive data. To ensure AI systems are equitable, developers must prioritize diverse datasets that represent the full spectrum of human experience. AI models trained on data from diverse populations can improve diagnosis and treatment recommendations for groups that are often underrepresented in clinical studies, such as older adults or racial minorities. We also have targeting rural and underserved areas. AI can be harnessed to bridge gaps in healthcare for rural populations. AI-driven tools can analyze medical images remotely, allowing specialists in urban centers to assist rural clinics. Additional AI chatbots can provide mental health support in areas where therapists are limited. We have improving accessibility. AI can AI can enhance accessibility for people with disabilities if it is designed with usability in mind. Systems can be optimized to generate high quality captions for individuals with hearing impairments or provide real time navigation assistance for those needing visual aid. By involving people with disabilities in the design process, developers can create tools that genuinely address their needs. And we have community engagement and transparency. Engaging disadvantaged communities in the AI development process is crucial. Involving these populations will allow developers to better understand the unique challenges people face.
Evidence based strategies are decisions and policies guided by rigorous and empirical research, systematic data, and evaluation, rather than the norms of traditions, intuition, or personal opinion. Other sectors that are referred to as non healthcare sectors, such as education, criminal justice, business, marketing, and public policy. Comparing healthcare to these non healthcare sectors highlights how evidence based approaches are adopted and implemented differently, and what healthcare can learn from these different sectors. The healthcare sector evidence based medicine practices and quality improvement initiatives are well established. Additionally, within healthcare, common tools include clinical guidelines as well as randomly controlled trials. In non healthcare sectors, there's a noticeable slowdown of evidence based approaches and evidence based management, especially in the business field. Another factor common in other sectors is that decision making is often based on experience or best practices rather than rigorous evaluation or other methods like it would be in the healthcare sector. In evidence based strategies, challenges exist. One of those is the diversity of evidence. Non health sectors often have fewer and less rigorous studies with limited randomized designs, which complicates the process of inferring causality. Another thing is the gaps in implementation. Despite the existence of evidence, translating it into practical action faces organizational shortcomings, resource constraints, as well as cultural resistance. The portability of evidence derived from the healthcare sector may not be directly applicable to other sectors due to the contextual differences that exist, as well as the measurement methods, risk tolerance, and the regulatory environments. Another thing that is at play is time delays and management factors. Delays between planning and conducting research can result in the evidence becoming outdated and invalid quickly. Opportunities that exist, though, include identifying obstacles, exploring the organizational, cultural, and structural factors that promote or hinder the adoption of evidence based practices, as well as comparative research, which conducts systematic studies of adopting, implementing, and scaling up evidence based strategies. Multidisciplinary integration combining insights from healthcare, business, and analytics, public policy, and education to improve the process as a whole. With the use of AI being in healthcare, ethical responsibilities are plenty. The rapid growth of artificial intelligence in healthcare has created both major opportunities and serious ethical challenges. As organizations adopt these tools for diagnosing, treating, and managing patient care, leaders must ensure that innovation does not come at the expense of the patient. Ethical standards for responsible use, ensuring that AI enhances care rather than introducing new risks or worsening disparities that already exist. AI is being adopted faster than many healthcare organizations can fully prepare for. The decisions that leaders make today will shape how safety and equitability impacts the future in the long run. Leaders must balance innovation with patient safety, ethical decision making, keeping the human side of healthcare as its main focus, even in the high tech environment that will exist now and in the future. AI in public health and medicine exists to make sure that it can be at its best for both people who are working in healthcare as well as consumers. Monitoring and evaluation as well as public and professional education needs to be done with a community involvement ethical framework that needs to exist for providers and patients as well as inclusive data and practices. Interdisciplinary teams as well as ethical data use, diverse funding, and bias mitigation are all things that need to exist for healthcare to get the best out of AI. The ethical use of AI in healthcare challenges exist. Organizational accountability to create ethic checkpoints throughout AI workflows by using advisory boards and prioritizing collaboration. Provide ongoing education on ethical AI practices to ensure that staff are using it responsibly into the capability that can be used. Ensure transparency in how AI models reach diagnostic or treatment outputs. Update codes and policies regularly to address AI use directly. Patient centered care. Evaluate multicultural impacts and biases in training data and algorithms to advocate for equitable data representation and culturally informed designs. The ethically responsible leadership actions that need to take place. Train staff on when to trust clinical judgment over algorithms. Develop clear override policies to prevent an over reliance on automation. Monitor performance data regularly to detect bias or drift. However, there is a huge amount of opportunity that exists with AI in healthcare. Research shows that ethical AI leadership means acting with both innovation and integrity. Healthcare leaders must guide AI adoption in ways that protect patients, promote fairness, and strengthen patient centered care. When governance, transparency, cultural awareness, and accountability are prioritized, AI has the potential to improve outcomes without compromising the ethical foundations that exist in healthcare.